One of the most effective methods of determining exactly where a patient needs to be adjusted is called motion palpation. In this case, what I'm doing is feeling the joints in the pelvis to figure out where the stiff joints lie. And then I'm going to work my way up the spine, making a mental note of exactly where the joints are moving freely and where the joints are stiff. And of course, those stiff joints are the ones that will be targeted for the adjustment. For those patients who are not good candidates for standard chiropractic manipulation, we can use a motorized adjusting tool called an Arthrostim, which is very, very comfortable and very, very safe and effective, especially for those patients who are much older, patients in their 60s and 70s and even 80s who cannot tolerate a standard chiropractic manipulation get very, very good results with this tool. It's completely safe and it has no side effects. We can also use the tool for the very, very young newborns, children 1, 2 years of age, also very effective for them. Manipulation of the spine can be assisted with special tables. Today we're using a Thompson drop table, and our patient has a restriction in this area of the thoracic spine. So we're going to elevate the table very slightly and then adjust. We can also adjust without using the table. Very short, very comfortable adjustment to mobilize that segment and give good relief to the patient. Neck adjustments are very gentle events. We first feel for where the joints in the neck are restricted, and then we apply a very comfortable, very gentle thrust, and that resets the joint and restores its normal motion. A vital part of lumbar spine, low back rehabilitation is strengthening the core muscles, and this is something we include in our patients' treatment plans. Here Stacy is doing some back extension on the exercise ball. In our office, manipulation is not limited only to the spine. I find in everyday practice that many patients have trouble with their feet, knees, hips, elbows, wrists, and even shoulders and jaw joints. And there are effective manipulations for every part of the body. In this case, for instance, we would be working on the second toe, and manipulation for that toe looks just like that, maybe with a little traction. And that motion is enough to mobilize that joint and very often give very good relief from even chronic problems. Throughout the years, we've seen many patients who have failed to get relief using other methods, and I find that one of the most common denominators in difficult low back pain is problems lower than the low back, problems with the knee, the ankle, and particularly the hip. And so I find it's indispensable to do a thorough evaluation of the range of motion of the hip joint. There should be good range of motion in each movement, and if there isn't, that's a telltale sign that that's a problem that we can work on and give very good relief to the low back by eliminating problems lower down in the spine. So-called side posture manipulations are very effective for relieving stress in the low back, and the sacroiliac joints in particular. This is accomplished by putting the patient in a side-lying posture and giving a gentle thrust, and that mobilizes the low back. In our office, we use the Cox decompression manipulation device, and this is extremely good for patients who have bulging discs in the low back, patients who suffer from sciatica. There's a gentle decompression generated by the machine. It's very controlled, very safe, and very comfortable for the patient. The instrument is also capable of feeling all the various motions that the lumbar spine is capable of producing, and by going through and checking a patient this way, we can tell exactly where a patient's joint restrictions lie, and then once we find those joint restrictions, we can very systematically loosen them up and give great relief to the patient.